Hey, May is Mental Health Awareness Month. We talked about that earlier. It is a topic we're going to revisit throughout the next 4 weeks right here on Start Your Day. This morning, we wanted to focus on our history and the impact it can have on our everyday lives. So here to talk about it is mental health clinician, Dr. Shonda Reynolds. Dr. Chanda, so good to see you. Thanks for starting your day with us here on BNC. Love the hair, by the way. Little Diana Ross thing going on for you. Go, reach out and touch somebody's hand. Anyway, that's enough of that. We've been dealing with trauma for centuries. And some psychologists say that trauma can impact people for generations. Obviously, we've been going through it as Black people, a lot of us, since the days of slavery. So how can our ancestors' issues with mental health have an impact on us?
Mike, that is such a great question. So I'm a believer that simply being Black in America is traumatic in itself. But I think Dr. Joy DeGroy did such an amazing job when she coined the term post-traumatic slave syndrome. And in her hypothesis, she essentially postulated that when a group of people goes through ancestral trauma, such as slavery, and that same group of people experiences racism and oppression and continued discrimination from years and years to come, then that group of people will experience emotional and psychological turmoil. And so we're experiencing that even today. And she even went further to say that a lot of Black people collectively are exhibiting symptoms of PTSD that go undiagnosed and untreated because of our ancestral history and that history of experiencing trauma day to day.
Yeah, it's one thing for professionals such as yourself to speak to it, but understanding it is key, it seems, and learning and listening to it. How does witnessing trauma today, not just in person, but like so many of us have on television or social media, affect our mental health?
Yeah, so when you think about trauma, it's important to think about it in the various domains in which it impacts us, right? So when we look at people who are gunned down by the police, our brothers and sisters such as Breonna Taylor, Ahmaud Arbery, George Floyd, we have to keep in mind that when we are witnessing these events, especially people within our community, it is likely that we'll experience some sort of a traumatic response because we call it vicarious trauma. So it's essentially being traumatized by watching somebody else's trauma. And so when we think about trauma in those domains, we have to think about how it impacts us on an emotional level. So we might feel angry, we might feel irritable, we may feel frustrated. It impacts us on a cognitive level or the way we think. So when individuals see people who look like them being gunned down, it makes us feel powerless. It makes us feel like we don't matter. It makes us feel hopeless in a sense. Therefore, in turn, it is important for us to constantly check in on ourselves from a emotional level as well as on a cognitive level, and even thinking physiologically, right? So trauma and witnessing these things on TV can impact us biologically. So think about the fight or flight response and how that can exacerbate all these different stress responses in the body. And it's not healthy for anybody to constantly be in that mode. And that's exactly what happens when we constantly see our brothers and sisters being gunned down.
Yeah, and it's so true because especially lately, you see everything, all the images on television, you just kind of get emotional, you get angry, you get sad, you feel helpless, but you still want to stay aware, you want to know what's going on. But how do you know when it's time to just turn it off? Where's that switch? Where's that line for most people, especially in the Black community?
I think for us, it's going to be so important for us to continue to check in with our emotions. So oftentimes we'll find that we're scrolling social media mindlessly, and we might scroll past a clip of a George Floyd for 9 minutes and 29 seconds. And we just talked about how traumatic that is, experiencing that vicarious trauma. Therefore, we have to know how to check in with ourselves and know when to take breaks. It is important for us to take breaks from social media. I'm a firm believer in that. I just came back from a break myself because if we do scroll social media mindlessly, we're going to be constantly re-exposed to Black trauma. And let's not forget that America capitalizes off of that. So
Yeah, America, it feels like we can't escape it, like you said. So checking out on social media is one thing, but having a professional that you can turn to regularly, therapy. It's hopefully becoming more and more normalized, but it's very difficult to find a qualified therapist because, well, therapists are people too. And if you don't go to the right one, they might not understand you. Yes?
100%. And so I'm a firm believer that, a therapist can be competent, they can be trained well with years of experience, and also that may not be the right therapist for you. So think about when you go shopping for a doctor, a PCP, it's the same process when you go to a therapist. Because they have the specific credentials doesn't necessarily mean that they'll be able to help you in the way in which that you need help. Therefore, it's going to be important for you to ask those questions that are important to you, such as, what are your cultural beliefs, or what are your values? What are your beliefs and experiences pertaining to the treatment of Black people in this country currently? And if that is someone who does resonate with you, if you feel as though they can help you on that level, then that might be the time to move forward. But again, I know plenty of people who feel as though their therapist isn't helping them, but that's no reason to be discouraged. It's just about finding the one that fits your needs at that time.
And you also want to be able to talk to somebody that you can relate to. And a lot of people want to talk to another Black therapist, but they're so rare out there. Only 4 to 5% of therapists out there are in the Black community. So we need more Black therapists. But along that line, if you can't find one, you need to talk to somebody. And I'm huge on that. Just find somebody that you're comfortable with. But for so long, you know how we are in Black community. We're so strong. We're so resilient. We feel like, hey, we're just going to deal with it because that's just life. How do you convince people who don't want to give therapy a chance that, hey, this shouldn't be just life? There's something more out there. You don't have to suffer in silence anymore.
Well, Mike, that's so difficult because suffering in silence has been our norm for centuries. So even when we think about the era of slavery, we think about how there were times where our ancestors may have been going through emotional turmoil and physical pain, and they may not have been able to express that. Right. And so that same narrative of having to be that strong Black woman or the strong Black man was passed down from generation to generation. And honestly, I'm a believer that that notion is what keeps us suffering in silence. So if we could really just normalize these conversations of therapy, normalize conversations on, you don't need to always be strong, and experiencing emotion does not equate to weakness. And so just really just perpetuating that notion so that other people in our community can really internalize with that, I think that will help to destigmatize it. And essentially just having conversations like these with family members and friends. I'm a firm believer that anybody can be an advocate of mental health. You don't have to have a degree to do that.
Amen.
Yeah. Well, amen. You're a treasure. Dr. Shonda Reynolds, thank you so much for starting your day with us. And we're going to take these lessons because it's more important now than ever. So thank you, Dr. Reynolds. We appreciate you.
She'll be back.